How bad will the second wave be in Iran? Hello, everyone. I'm François Picard. Welcome to the France 24 debate. Authorities in Tehran lifting the lockdown on religious gatherings in 132 cities, part of a gradual easing of confinement that began on April the 11th. This in a nation hit early and hard by COVID-19. For authorities, well, it's a case of pick your druthers. Keep the sanctions-squeezed country in lockdown and risk a complete collapse of the economy, or open up and hope there won't be a dramatic spike in new coronavirus infections. That may be what's already happening. Tuesday, the health ministry reporting a resurgence of COVID-19 in nearly half of the country's 31 provinces. What's the true picture? How to respond when state coffers are already empty? And what to do when your most powerful foe, the United States, is doubling down on those sanctions to the point where it's spooking traditional trading partners like China. Oh, and did we mention that the value of the country's top export has collapsed? Yes, we'll ask what the prospect of cheap oil and gas means for ordinary Iranian citizens. Today in the France 24 debate, we're looking at Iran's second wave. And with us to talk about it from London, Esfandyar Batmanghelidj. He is the founder of the economic think tank Bourse and Bazaar. Welcome to the show.
Thank you for having me.
I want to welcome from Washington, D.C., Behnam Taleblu, senior fellow covering Iran at the Foundation for Democracy's think tank. Welcome back to the debate.
Thank you again for having me.
And France 24's Sanam Shantyaei is with us as well. How are you, Sanam?
Very well, thank you. Thanks for hosting me on your show today, François.
Well, we're going to begin with a piece of your show, the France 24 debate on Facebook and Twitter, hashtag F24debate. Sanam, this week on Middle East Matters, you spoke with a medic inside of Iran.
Indeed, François, I spoke to a medic in Tehran who asked for his identity not to be divulged because he was very much critical of the way the Iranian government has handled this crisis. Something to keep in mind before we listen to that is that some issues that he addresses are very much global. We've experienced them even here in France. Others point to mismanagement, a lack of transparency, and on some level, sanctions. We'll delve into that after we listen to the interview together.
I think the Iranian coronavirus response was one of the worst. We were one of the few countries that maintained direct flights to China until the very last moment. I believe there were hundreds of Chinese clerical scholars in Iran who were still travelling back and forth to their country, China, during this period. There was also a great deal of pressure in the lead up to the annual rally celebrating the anniversary of the Islamic Revolution in February and the parliamentary election that followed. Medical staff were urged not to use masks or shields so they wouldn't alarm the population. And once the arrival of the disease was finally announced, people weren't taking the right measures because in the first 2 to 3 weeks they said that COVID-19 was just a common virus, like a common cold. All of this led to a spike in the number of infections. Also, the numbers that were being announced on the radio and TV were much lower than what we were dealing with. In my experience, it was 4 to 5 times more than what was announced, but TV outlets insisted that numbers were low, so people weren't taking it very seriously.
Now, you just mentioned that in reality, in your experience, the numbers have been higher than what the authorities have been announcing. Tell us about some cases that you dealt with where you believe that the patient died from the virus, but the death certificate stated something rather different.
One of the reasons that the death toll in Iran is relatively low is that we had patients who had very clear symptoms linked with the disease. We also used CT scans to check for COVID-19 infections. But because the testing kits that we used did not correspond with international standards, the results would come back as a false negative. So the Ministry of Health decided to dismiss coronavirus as a reason of death for these patients. I myself had a private patient. He had previously had a kidney transplant. He contracted the virus and died in ICU. When his family wanted to collect his body, authorities said they would only release it under the condition that they state kidney failure on the death certificate, which was the underlying health issue. I believe there are very few doctors across Iran that haven't dealt with similar cases.
Can you now tell us about the shortages of equipment that you've experienced on the front lines, which has actually been very much a global issue?
During the first month, we had a real shortage of masks. Prices were low at the time, so people were bulk buying, and we ran out. As for testing kits, many were faulty. The majority of the results were false negative, even if the patient was showing highly suspicious coronavirus symptoms. These kits weren't very trustworthy. As for the respiratory protective devices, when we had a high number of cases at the beginning, there were especially shortages in smaller towns and cities. But we're okay at the moment. Those shortages have been addressed over the past 2 to 3 weeks.
Of course, another rather alarming problem in Iran is that some pharmacies do give out medication without prescription, which can be dangerous when dealing with, let's say, hydroxychloroquine, a medication that, despite really scattered evidence, is being used in some countries to treat the coronavirus.
Indeed, Iran is one of the few countries where it's possible to obtain drugs without a prescription. So at the beginning, we actually had a shortage of hydroxychloroquine. People were self-administering it in high numbers, while it's something that needs to be supervised by medical professionals. We've since heard about several cases from colleagues of people developing heart complications, experiencing blurred vision, and this isn't a new problem in Iran.
Doctor, as I mentioned earlier, with the number of cases decreasing in Iran reportedly, authorities have had to weigh up health risks against economic risks, and so they have been opening up. Are there concerns about a second wave being potentially more aggressive?
Unfortunately, quarantine was lifted across Iran quite drastically, officially and unofficially. Employees had to go back to work. I guess in Tehran, around 70% of them are back now. So it's likely that we will see a stronger wave of the virus, with a higher death toll, as it will be transmitted from person to person. You can't put the economy before science.
Sanam Shantyaei, you mentioned at the outset how there are, in what he said, gripes that are universal, shortages of masks, testing kits that are more or less reliable, the cause of death, which is not announced the same way according to different countries. We're seeing that right here in Europe. What struck you, though, listening to him?
Look, I think I want to peel this back layer by layer, certainly some elements of it. It was well documented that Iran continued direct flights to China at a time where other countries were very much taking cautionary measures to stop the spread of the virus. And this is in part because of Iran's dependence on China when it comes to trade. But of course, as one of our panelists here, Esfandyar, has extensively written about this, that itself has actually dropped significantly. I'm sure you'll delve into that a little bit later. Now, also acknowledging the disease in the earlier stages of the pandemic, in the eyes of Iran's authorities, would have very much meant, and this is something that the medic spoke about, a very low turnout even of voters in the country's parliamentary elections, which incidentally ended up happening again, 42%, the lowest it's ever been since 1979, which was the year of the Islamic Revolution. That was mainly due to dissatisfaction across the country because of the downing of the Ukrainian airline, because of the removal of an unprecedented number of reformist candidates from the elections, and the list goes on. Now, looking at the timeline, and I remember this very vividly at the time, there was a refusal to impose this official quarantine on the epicenter of the virus, which was the holy city of Qom at the time, and of course the capital, Tehran, something that we've actually seen in the UK because of the economic issues. Now, last but not least, it doesn't matter, in my opinion, which side of the argument you stand on when it comes to sanctions and punitive measures. They do prevent Iran from making certain purchases because of the financial restrictions that they impose on the country. It does appear as though that they're not facing those shortages at the moment. But again, as we heard at the end of that interview, there is a great deal of concern about the second wave of COVID-19 being a lot more aggressive in the Islamic Republic.
We had the Iranian health ministry, Esfandyar Batmanghelidj, on Tuesday saying there is a significant uptick in the number of new cases. Big cities like Tehran and Isfahan, and also the holy city of Qom.
Yeah, exactly. And there's obviously been an internal debate in the Rouhani administration about the relaxing of the lockdown. And health ministry officials have been clear that they see it as a significant risk. And as we just heard from the medical professional that Sanam interviewed, there is this sense that, is it a mistake to put the economy ahead of public health? And certainly from an ethical standpoint, we would think it might be. But at the same time, I think we need to remember that Iran is facing this challenge like many countries where now the lockdown measures are being relaxed because of economic pressure. But in some ways, Iran's position is unique because the country has experienced 2 years of significant economic contraction. And so ordinary Iranians may have, for example, spent their savings over the last 2 years to get through the difficult times that they have already gone through. And now, particularly for those who earn a daily wage, like day laborers, or those who are in sort of the manufacturing sector where any protracted downturn is a threat to their jobs, it's very difficult for them to sort of balance this idea that they need to stay home to contribute to the public health response versus the simple economic fact that they may not be earning enough to support their families. And I think that this has put the government in a significant bind. And of course, the Rouhani administration, in relaxing the lockdown, is taking a bit of a gamble about whether or not the economic relief that will be sort of gained will outweigh, in some sense, the possibility of further infections and a second wave that's been warned about by the medical professionals.
Behnam Ben Taleblu, you're in the United States, where you have a president who every day, it seems, is calling for the economy to restart and an easing of confinement rules. Did Iran do the right thing in beginning to ease that lockdown?
In my view, no. And while, again, this is a global pandemic and every country is going to experience the coronavirus crisis in a unique way, there are preconditions that, the Iranian relationship with China predispose it to make it into something of a unique case. Again, as Sanam mentioned, the fact that there are documented flights anywhere from 50 to 55 of an IRGC-owned or controlled airline going to China during the time that the crisis was actually unveiled, mid to late February into March, of course. And then, of course, there's what made Iran in terms of deaths, because in terms of infections right now, if you look at official data, Turkey is beginning to overtake Iran. But if you look at the death rate, at least the official death rate, what makes it the Middle Eastern epicenter? And it's really 3 T's: trade, tourism, and terrorism. And the trade one, as Esfandyar knows, has taken a bit of a hit, but in the 2 dimensions that have mattered significantly for the Islamic Republic in the past year and a half, 2 years, to try to outlast this U.S. max pressure campaign. That's the non-oil trade, particularly the non-oil regional trade, and the illicit oil trade. And both of them have gone down, but both of them have continued nonetheless because the Islamic Republic believes it's vital to try to outlast max pressure.
Well, let me just interrupt you on that point briefly. Esfandyar Batmanghelidj, a piece you wrote for Bloomberg Opinions, you're saying the Chinese have definitely been spooked by U.S. sanctions, and even before COVID-19 had started winding down their oil purchases.
Yes, and we've seen this weakening or a downgrading in China's trade relationship with Iran for over a year now, and it's obviously a response to kind of the linkage between the Iran sanctions pressure that China is facing, particularly some of the large state enterprises like Huawei, But it's also linked to the negotiations that were concurrent at the time around a trade deal with the Trump administration. And there was clearly some sense, I think, among Chinese policymakers that they should make some concessions on, let's say, their continued economic support of Iran in order not to jeopardize the agreement that was being negotiated with the United States. Where we are now is that, as Behnam pointed out, this sort of dilemma led Iran to perhaps make a significant mistake in maintaining its flights to China at the outset of the coronavirus outbreak. And certainly voices within Iran, and particularly within Iran's private sector, have been quite critical of the government for continuing those flights and for generally a perceived dependence on China. But the question of Iran's economic resiliency and the recourse to trade is a part of the public health question as well, because what we would want to see in Iran, if we are to imagine a robust response to this global pandemic, is a degree of economic stability. I think it's unreasonable to expect Iran to get the public health response right if it's still dealing with kind of the wreckage of 2 years of economic crisis imposed by the Trump administration through its sanctions. And so there's an onus for policymakers in the West, and particularly in Washington, to think about what they can do to provide a modicum of economic support to Iran so that the public health response doesn't put medical professionals in the bind that they're in right now.
Behnam Ben Taleblu, borders are porous. Iran has borders with Afghanistan, Turkey, Iraq, all countries with which the United States, if we're going to think very crassly transactionally, has closer ties. Isn't it in Donald Trump's interest to help Iran in this case?
Well, very interestingly, the U.S. a few months ago had made a pretty tough political decision to actually designate the central bank of Iran under terrorism authorities, which reputationally is more sticky to try to unwind or walk back, both strategically and politically for this president or for any future president. But as you know, even there's a Swiss channel that is now, pursuant to a waiver, able to touch the CBI to process transactions. So the U.S. has even done some of these things to actually permit trade to continue or facilitate further trade on the humanitarian front. So that's one vector. You mentioned trade and borders and the porous kind of geographic environment around Iran. That brings me back to the two T's that were remaining in that triad of T's. You had, of course, trade, but then you also have tourism and terrorism. You know, what really made Iran and some of the other countries that Iran has touch points to in the region this epicenter is tourism, particularly religious tourism. Remember, there are actually Chinese pupils in the holy city of Rome. There's also a Belt and Road Initiative, the Chinese One Belt, One Road policy, that is actually building a high-speed railway in the holy city of Rome. And then, of course, there's terrorism. And that kind of will touch off with what Esfandyar said about what priorities policymakers have in the West as of 2 years ago and as of this Friday, which is the second year anniversary of the U.S. leaving the deal. The predicate for the sanctions remains not some key decisions or key public health crises in the global economy, but key decisions made by the leaders of the Islamic Republic. And you see that in the behavior of the regime, where actually there's been an uptick in some of the most destabilizing policies of this government.
But Behnam, this is a public health crisis.
This
is a public health crisis. Shouldn't we be doing everything we can?
It is a public health crisis.
Shouldn't we be doing everything we can so that the whole planet is spared this disease?
I think every country is struggling with this disease, absolutely. But it's the priority and responsibility of every single government to put the rights and interests and values of their own people first. And there is a 41-year dissonance of this happening inside the Islamic Republic. And perhaps more importantly, you see things like a second-stage solid propellant satellite launch vehicle happening in a period of 4 months, continued Iranian weapons shipments going to Yemen, escalation during the month of March in Iraq such that it kills not just Americans, but coalition soldiers, including Brits. These are poor, irresponsible decisions. And this is time, money, and effort at the national level spent on issues that should be spent on dealing with the pandemic.
Here's a yes or no question for you. Early March, Iran submits a request for $5 billion in emergency assistance from the International Monetary Fund. They're still going over the paperwork at the IMF. We have received a request for assistance, and since we've had limited engagement with Iran in recent times, the process of obtaining the information we require to assess the request is taking time. the Middle East and Central Asia Department head at the IMF, told the Financial Times. Should the IMF be green-lighting that $5 billion in emergency aid?
To me, if you were looking for a yes or no answer, the answer is no. There's a backlog to that. I think the reason they're going to be dragging, the reason they're going to be talking about the time it takes is because they're going to be dragging their feet. There may be a pocket veto at the end of this with the US or some of the other nations. I certainly am no international financial institutions expert when it comes to the IMF and World Bank, but I think the answer is no. And the priority is to be able to say, if Iran does have significant reserves, and if Khamenei was able to mobilize, I don't remember how many billion in mid to late March, something of Iran's kind of like national sovereign wealth fund, why wasn't that money tapped into during the month of February and during early March? Why did the foreign ministry of the Islamic Republic go around having this whole sanctions campaign, sanctions removal debate, rather than actually press their own government to mobilize and get that money out earlier?
Esfandyar, Batmanghelidj, you agree?
No, I don't. And I think, unfortunately, a lot of how Behnam has sort of framed this debate is a bit of a cop-out for the US not doing enough to ease humanitarian trade. The best example of this is if we go to the Swiss channel that Behnam mentioned, which was launched in January of this year. And it took a year to set up that channel between negotiations where the Swiss government had asked the US to open such a channel because Switzerland is an important exporter of medical supplies. And the fact of the matter is that since January, when the channel conducted its first pilot transaction, there have been no further transactions through that channel, meaning that the main tool that the Trump administration has presented as evidence of its commitment to protecting humanitarian trade has not facilitated any sales of medication during Iran's COVID-19 outbreak, the time when, the country needed the most assistance. And what this evidences to me is the fact that we are having the wrong conversation about really what the international responsibility is here. Behnam, I think, points out concerns, true national security concerns that European and American stakeholders may have about Iran's regional activity. But to present those arguments as evidence that Iran somehow, and particularly the Iranian people, deserve or should only expect to deal with the nature of the outbreak that they're confronting right now is frankly disingenuous and does not speak to the kinds of humanitarian commitments that we would expect Western policymaking to put at its heart. The simple fact is that the US has not done enough to ease humanitarian trade. And if we go to the IMF request and you acknowledge that the governor of Iran's central bank has even suggested that the $5 billion loan be dispersed through the Swiss channel that has US oversight, that was set up by the Treasury Department, you recognize that the Iranian government is not here trying to have some sort of duplicitous approach to sanctions relief. I think they're trying to get their hands on practical resources so that they can avoid the difficult trade-off between the economic crisis they're facing and the public health crisis they're facing. And, it's disheartening that in the US, we haven't been able to get a conversation going. And part of it's because, of course, governments around the world are in their own crisis mode about what we do in this instance. But part of the problem is that maximum pressure sanctions have been designed to interfere even with humanitarian trade and precisely to use moments of crisis to try and advance their political aims. And the problem here is that there's an incentive for the Trump administration, given what they would like to see in Iran, which is devastation, to allow this kind of crisis to continue to roll without an answer, an effective response from the Iranian government. And they're essentially trying to stoke the crisis further through their own inaction.
Sanam Shantyaei, let's just, for our viewers here for a second, go over the timeline, because we talk at the outset about how there's the potential for this deadly second wave of COVID-19 in Iran. Just to remind us that Iran has been through a lot in the past year. There's the squeeze of sanctions. There was social unrest last November. And you look at the government borrowing as a percentage of GDP for 2019. Gosh, Iran is in a league with the likes of Lebanon, Venezuela, Zambia, South Africa, and Jordan.
That's the thing, François. The value of Iran's currency has fallen by, I believe it's 60%, if I'm not mistaken. It's got a budget deficit of between, I think, 30 to 50% for this fiscal year. I think it's impossible. I have to disagree with Behnam's view that it's impossible to say that these sanctions, and this is a point of view that's very much touted by the organization that he works for, Foundation for Defense of Democracies, that they're not having an impact, that the loan that Iran has requested, the first of its kind since, if I'm not mistaken, since 1962 from the IMF, that it will go towards its regional activity. I think you just really have to look at the bigger picture there. And I got this impression from the conversation that I had with a medic, the interview which we watched together at the beginning of the program. I think you have to, it doesn't matter, again, I repeat this, what side of the argument you stand on. If you're looking at this from the outside, if a foreign medical supply exists, would they risk sending any medical equipment to Iran at a time where it's facing this health crisis that we're seeing across the globe? Would they do that? Would they send equipment over if there is a possibility that that equipment could be utilized by, let's say, a hospital, which is somehow linked to the Revolutionary Guards? Of course, that's officially one of the three main branches of Iran's armed forces, but at the same time, incidentally, it's been designated by the US as a terrorist organization. Who wants to take that kind of a risk? So shortages, because of these restrictions imposed by the United States and the international community, are inevitable. And he's not alone. I also spoke to someone in the pharmaceutical industry. There's a great deal of pressure domestically to start producing to meet need, but they're not meeting international standards, as again we heard in that interview. And the problem is, once they are able to bring the products into the country, the prices are 3, 4, 5 times higher. And in light of the economic situation that Iran is facing, that is not sustainable. And I think the bigger question that we need to ask ourselves is, at a time where Iran is not able to conduct trade, one of its main partners, China, as you and Esfandyar mentioned earlier in the program, that itself has dropped dramatically. Is this Swiss channel enough? Is it sustainable? I don't believe so.
Behnam, Ben Taleblu?
Well, what also matters is, of course, Swiss trade with Iran. And here we can actually have data that has aggregate EU trade, aggregate Swiss trade, and then take out the pharmaceutical trade. Pharmaceutical humanitarian trade from the Swiss government to Iran actually continued. And you can measure, as FDD has done, because, Sanam, with immense respect, you mentioned my organization, it's not a particular line. These are policy views informed by data. And so best to confront us on these views informed by data. And, Esfandyar mentioned something about, I think it was with respect, of course, the tough trade-off that Iran's government will have to make between guns and butter. These are trade-offs between what priorities governments will choose to have. Do you want to keep doing these activities during peak coronavirus crisis conditions, or do you want to prioritize the health and welfare of your own people? There's also a larger policy debate we need to have here. And that policy debate is one that Washington has actually put on the table by reinstituting and then adding to these sanctions, which is, if you believe in principle that Iran's destabilizing activities in the region need to be confronted, if you believe in principle that Iran should not have a nuclear weapon, if you believe in principle that there are other ways that one should be rolling back Iran's activities, and you don't want to use America's most powerful, peaceful, non-kinetic tools of coercion, punishment, and deterrence, then what other policy option do you have?
All right, let me put
respond to that?
Go ahead, Esfandyar.
Thanks. I think we should remember that Iran is not one actor. When we say Iran, we don't mean there's one decision maker. And, Behnam's point about prioritization, I think, is an important one. Countries have to always reconsider their priorities. And I strongly believe that, there are instances where the Iranian government has consistently failed to prioritize the well-being of the public over certain national security goals that they might have, or certain economic goals that they might have. But it's, I think, disingenuous to ignore the fact that we should assume that Iran's public health sector, its Ministry of Health, its doctors and nurses are putting the well-being of their patients first and foremost. And so the question is, in recognition of their prioritization, what steps can the international community take to ensure they have the tools and the means and the resources to fulfill the public health response that they believe is in the interests of their fellow Iranians? And that's where the logic of, I think, Behnam's response breaks down, because we're essentially holding them responsible for priorities that are outside of their control. And to the point about the ongoing trade between Europe and Switzerland, for example, and Iran in the medical space, if we're going to have a data-driven argument, if we look at the data going back to 2012, when the Obama administration first imposed sanctions, financial sanctions on Iran that significantly disrupted trade, even in humanitarian goods, between Iran and European countries, what we find is that a country that has consistently grown in sort of the size of its economy, where demand has grown consistently over the last decade for medicine and medical devices, has since 2012 basically flatlined in the value and quantity of medical goods that it's been able to import. So you have a public health sector that has not been able to grow in accordance with the needs of the Iranian public for medication and medical services. And that's the problem here. I think we're cherry picking data to make the argument that, you know, the situation isn't so bad, or that Iran somehow deserves the dilemma that is currently in because of priorities that are being set by certain parts of the government. But it's ultimately, I think, a cop-out from the actual conversation that needs to be had about whether or not the policies that Behnam is talking about are doing more harm than good in this specific area of humanitarian trade, which by the letter of US law is supposed to be a carve-out that is respected and protected, and it has not been under this administration, and that is the problem.
Behnam, let me put the question to you differently. Huge stimulus plans all over the globe right now to try to prevent economies from crashing. In Germany, their package is the equivalent of 20% of GDP. In the US, 10% of GDP, huge numbers. The Iranian plan is 2% of GDP, and there's criticism that a lot of it isn't grants, but mostly loans to individuals and small businesses that'll have to be paid back somehow. Do authorities in Tehran secretly have cash kicking about that they're using instead to prop up insurgencies in the region that they could be using for this humanitarian effort?
Well, it'd be one thing to say that they have the money on hand for insurgencies in the region, which we know they do. And just as the measure, you know, in terms of a national security argument driven by economics, it is much cheaper to arm, train, and equip a shoeless Afghan child to go fight in the Syrian jihad than it is to arm, train, and equip a Green Beret or a formal member of a foreign country or a Western country's armed forces, for instance. But that point aside, yes, there are large parastatal institutions. There's Khamenei's own private empire, upwards in the $90 billion that, of course, could be tapped into. There are other sources.
How much money are you talking about?
There's a Reuters report from 2013 that says 93 billion. There's an aggregate back of the envelope calculation where if you take some of Iran's other major parastatal institutions like the Bunyad al-Mustaza Fund, the Foundation of the Impressed, that could be upwards of 200 billion. This is money that actually exists inside the country. It's not just in liquid reserves.
We're running short on time, so I want to bring in Esfandyar Batmanghelidj. Do you agree on those sums?
It's an irrelevant argument to make, because let's say the Supreme Leader woke up tomorrow and decided, you know what, I'm going to use my assets to try and address this problem, or that the state decided to use internal assets. If he even wanted to, or any Iranian state organization wanted to mobilize these assets to purchase medical supplies, they would be unable to for precisely the same barriers that are preventing the country from accessing normal supply chains in medical trade, or for making payments to European banks for the goods that they're purchasing. I think it's these figures are being used to distract from the actual areas in which the US sanctions policy is not succeeding in facilitating humanitarian trade. You know, Iran's ability to use internal assets that could be real estate and are denominated in rials, you know, it's not like they can go suddenly and say, you know, we want to buy $1 million worth of this important medication for use in the country. Iran, and this is more relevant to this conversation, has significant reserves from its historic sales of oil in central banks around the world. And by some estimates, that's around $90 billion. I think the country would be very happy to use those funds and would be seeking to use those funds in order to make payments. And we know that the central bank governor has made a point of this in a recent interview with Bloomberg. The problem being that when the Trump administration imposed sanctions, particularly the terrorism designation on the Central Bank of Iran in September, which it then tried to repair in February with a different legal action, it essentially dismantled the system that allowed Iran to use its reserves to pay for humanitarian trade in a timely way, which is precisely the reason why the Swiss mechanism hasn't been able to facilitate a transaction since January. So,
all right, let me just
this
briefly, again,
conversation
we're running short on time.
Please.
So let me bring in, let's just briefly, before we go, talk about how this is all weighing on the domestic scene. We mentioned there isn't just one decision maker in Iran. A few days back, our correspondent Reza Sayeh went and interviewed the reformist mayor of Tehran, Piruz Hanachi. He'd just gotten off a conference call with the mayor of London, Sadiq Khan.
I thought the connection between mayors of major cities and capitals could be comforting to one another. It was about acknowledging their hard work, getting to know their challenges, and exchanging experiences.
Sanam Shantyaei, how is COVID-19 weighing on the domestic political scene in Iran?
I think that's probably a very difficult question, because you have different voices, as always, polarizing voices coming from different camps, parties. I don't know what you want to call them these days. But certainly it appears as though there are rumors circulating that the more hardline elements in the country, the Revolutionary Guards amongst them, are taking advantage of the situation, as they often have. I think the bigger question, something that I want to go back to, is a lot of proponents of diplomacy between Tehran and Washington, something that you guys were discussing earlier. Amongst them, some European diplomats that I've been having conversations had actually perceived this crisis as this opportunity for detente between the two, because they are essentially, they have a common foe, COVID-19. Previously, we had the Islamic State group, for example. And you do have global powers, you do have international NGOs calling for the US to suspend these economic sanctions that are hitting Iran hard. Again, doesn't matter what side of the argument you stand on, this is fact. On the contrary, you're seeing the United States, the US administration, led by certain organizations in the US, seeing this as an opportunity to use it as essentially the straw that broke the camel's back as part of their maximum pressure campaign. And I think the one thing that we can have for our viewers here, food for thought, is how this is what kind of an impact this is having on ordinary Iranians at the moment.
Yeah, what have you found on that score?
Speaking to people every day, certainly for my own program, Middle East Matters, for this show, and they're having a rough time of it, Francois. We spoke about inflation earlier. I spoke to one woman whose children are very afraid because unemployment is rife. I mean, the official figure at the moment, I believe it could be much higher than this, stands at 10%, which was the figure in 2019. Unemployment was rife prior to this crisis. It's going to get even worse now. Esfandyar was speaking about the day workers, something that we're seeing across the region, people who really take a hit. Now, I think the one thing that one woman that said to me yesterday, which really stood out, was in Iran, we didn't see bulk buying at the beginning of the quasi-confinement. And the reason that we didn't see that is because, frankly, people don't even have the purchasing power to do that, to clear out supermarkets, something that we saw even here in France or the US. So the ordinary people should not be forgotten about when we speak about this bigger picture.
And just in 30 seconds, Sanam, Iran's been under sanctions for years. Is this very different, what you just described, from what was going on before COVID-19?
What do you mean?
In terms of the hardship for ordinary citizens?
No, but I think, again, this is a global issue. It's the economy of all these countries have been exacerbated by this crisis. And Iran in particular, as does Venezuela, as do various other countries who are facing these punitive measures, are in a more tricky situation. The big question is, for example, asking a loan that they did from the International Monetary Fund is not a massive loan if you compare it to certain countries. You did earlier with others. I'll compare it to Qatar, which has injected, I believe it's 43 billion. It's to a much smaller economy in comparison to Iran. The big question is, do we start taking a bigger look at what Iran is in need of in light of these punitive measures, which are very heavy, and they are taking their toll?
All right, we're going to leave it there. Unfortunately, much more to talk about, though. Sanam Shantyaei, I want to thank you so much for joining us from Paris. I want to thank Esfandyar Batmanghelidj for being with us from London, Behnam Taleblu in Washington, D.C. Thank you for joining us here in the France 24 debate. You can subscribe, by the way, to our YouTube channel, and also follow us on Facebook and on France24.com.
As a field reporter, you really get a sense of just how important it is to be able to go and check out things for yourselves on the ground. One example which stays in my mind is when I went up to northeastern Nigeria with my colleague Jonathan Walsh, and we wanted to do a report about the impact the Islamist group Boko Haram had left on the communities there. And we were being told by the Nigerian army for months that they had won the ground war, that the militants no longer posed a threat. And as soon as we were in the zone for ourselves, we could see that that was just clearly not the case. There were some roads that our local fixer, our producer, was absolutely terrified to take for fear of being kidnapped. We were flown out to enclaves of land by the UN by helicopter because we couldn't drive there. People were too afraid to go back to their homes a kilometre away because there was still fighting going on. And we even located one active Boko Haram member living in a refugee camp who told us he was still in regular contact with fighters out in the woods. So that really highlighted for me how important it is to go and see for yourselves what's happening and not believe what's in official statement, press releases or communiques.
Liberté, égalité, actualité.